Hello, everyone. Welcome. Thank you for joining us today. I'm Ann Cosgrove, the Editor-in-Chief of Facility Executive Magazine, and we look forward to this webinar with you and our two speakers, who you can hopefully see on your screen. John would like to watch us on video, gray bar on the top or side of your screen, and you will see us. So without further ado, we'll jump in. This webinar today is presented by Gordian, and the topic, as you well know, is facilities trends and considerations. Where do we go from here? We're looking to talk about some of the project planning strategies and maybe challenges and opportunities that you all have run into with the onset of COVID-19 in the past year or so. And we're looking forward to a talk from John and Gabby about what they're seeing, as well as some advice around that topic. So before we get started, I'd like to cover a few housekeeping items. On your screen, you'll see the control panel. We'll have a Q&A at the end of the presentation, at the end of the talk. We welcome your questions and comments in that question box. You simply type in your questions and we will answer them at the Q&A toward the end. If you have any questions that you'd like, technical difficulties or other types of non-content questions, you can also type your question in there and someone will answer you privately. If you're interested in a continuing education credit, you will receive an email from Facility Executive after the webinar, and you can apply that to your association if you wish. Now I would like to introduce your speakers. And today you have Gabby Rosas. She is, oh, I'm sorry, first we'll go over the agenda. We can go back, Neil. Sorry, everyone. We'll go over the agenda first. Welcome and introductions. Now, I do want to mention that I mentioned a survey, and what that is Gordian had done a survey with Facility Executive this past spring of some of our readers to see what they've been doing in terms of their project planning. So we're going to go over that. That'll really be the bulk of this presentation. And obviously, as I said, we'd like to hear from our speakers and see what you all, if you have any thoughts to share in that question section, please do so. There will also be key takeaways in the Q&A, as I mentioned. Okay, next slide. So our speakers, we have Gabby on screen here. She is a solutions specialist with Gordian, and she's focused on helping organizations identify and execute on their facility planning initiatives. She's been with Gordian for 16 years and currently based out of Oregon. John is an account manager based out of Texas. He's worked at Gordian for over 8 years, and he prides himself on developing long-term relationships with a portfolio of clients and working with facility owners to determine the best fit for them as it relates to Gordian's construction procurement solutions. So we're looking forward, again, as I said, to a great discussion. Welcome, everyone. And we can move along to talking about the survey and jumping right in. As I mentioned, there was a survey Gordian put out to some of our readers this spring, and here we go. Let's see. So breakdown of survey respondents. To give you a sense of who answered this survey and so what some of these results are based on that you'll see today. Higher education was 13%, K through 12, 13%, business professional services 11%, healthcare 10%, commercial manufacturing, interior design, and other rounded it out. So that really reflects a lot of our readership and a lot of who Gordian does work with. So we can move forward. Okay, so one of the first questions we asked was, how have you adapted your facilities due to COVID-19? And what we were asking there was some of the actual practical steps that folks had taken. And as would be expected, as I'm sure all of you out in the audience who have dealt with this in your facilities, social distancing, nearly 100%, transition to remote work, 68%, and that's a lot of what we're all dealing with now, I think, in those settings, returning to some degree, barrier 63%. So I won't go through that all. I know Gabby and John will talk about that. And for this slide, we're going to have John first talk about it, and then Gabby can jump in. Looking forward to a great conversation. Hi, John. Hi, Gabby.
Thank you, Ann, and good afternoon, everyone, and thanks for joining us. After a crisis comes recovery. We're in that recovery period now. As we begin to move forward, we see government and public authorities and businesses alike really starting to rethink, adapt, and recover. So it's no surprise that we find that social distancing is actually one of the top responses to this survey question. As we begin to adapt to the current spaces that we have now, workplaces are starting to think about workspace capacity, right? after COVID, we're coming back into the offices, or some of us anyway, are coming back into the offices, and we're beginning to rethink about space, right? Creating a space between folks, looking at capacity in anything as far as restrooms go. What's the capacity for that? So we're starting to see a lot of changes as we come back to the offices as well. We've seen a lot of facilities go through major changes, some minor, some major. We've seen a lot of folks reallocate space. A good example of this is back in 2020, El Paso, Texas, the El Paso Convention Center temporarily transformed their convention center into a healthcare facility to tend to some of those folks that we weren't able to actually care for in the hospital environment. I think a lot of us have seen, at least here in my city, we've seen some local hospitals repurposing space. Parking lots was a very common thing for us. We repurposed those into temporary facilities as well by putting up some tents and putting some modular furniture and whatnot into those as well. So seen a lot of changes since the whole COVID has impacted us all. And so as we move forward, we begin to think about some of the things that we need to change. Next slide.
So yes, thank you, John. So how did COVID-19 impact your project priorities? That was one of the next questions we asked. And as you can see here, 62% noted they had to halt or postpone planned projects. 57% executed projects to meet new safety protocols. So those were arising out of the pandemic situation. 28% canceled projects, 22% planned projects experienced expedited timelines, and 13%, I don't know if took advantage is the right word, but most likely federal funding allowed us to address more or new projects. So halt postponing and then those new safety protocols. So there was like kind of a two-tiered thing there. Can you talk about that, John?
Sure, absolutely. So obviously we did see a lot of postponing during the 2020 year as we kind of started treading into unfamiliar territory. We didn't know exactly how the COVID-19 was going to impact us all. However, when it hit us, we were all quite surprised and led to postponing, led to reallocating projects, led to cancellations of sorts. One of the things that we've experienced quite a bit actually in 2020 was obviously the postponing of projects. We saw a lot of this, especially in the higher ed, and in the higher ed, especially in the housing departments, where we depend a lot on the student body, or where they depend a lot on the student body volume. And when the impact happened back in 2020, well, obviously we didn't get students moving into the dorms. And so that really created a big challenge for the housing units or the housing departments in higher ed, especially because now that they didn't have the student bodies moving into the dorms, they didn't have the volume, they didn't have the funds to actually move forward with some of those projects that they actually had scheduled at that particular time. So there was quite a few challenges there to overcome. New safety protocols, obviously with the impact of COVID-19, a lot of safety protocols have been relooked at and revisited throughout the state and throughout the country, for that matter, trying to figure out what's the best way to create a safe space for folks coming back. And again, as I mentioned, every crisis has a recovery period, and I think we were all moving towards that. We had to change our mindset and start thinking about ways to get people back in, or at least ways to continue on with business. And lastly, that I'd like to talk about here is just the canceling of projects. We did see quite a few of those back in 2020, and some of those just never made it back to the list as far as those projects. And I think Gabby will touch a little bit on reallocating some of those spaces, or even repurposing some of those spaces for some of those projects that were actually canceled. And
Yeah, if I could hop in here and talk a little bit to the planned projects with expedited timelines, as well as John mentioned, shifting the use of space. We actually heard from a lot of our clients who are going through this rush to figure out how do we react, how do we respond, that we're trying to make lemonade out of the lemons or the hand they've been dealt. And some of the creative solutions that they found was really reconsidering maybe there was a mothballed building within their organization or on their campus. What would it take to get that to a space where it could become a potential swing space for housing? I know we worked with a school in Oklahoma who was trying to figure out, oh, this residence hall was slated for demolition, but if we can revamp that to give students more space, those who did come to campus, and start to spread them out. We also saw organizations looking at the projects that they did have on their timeline, or the funding that they did have allocated. How do we reprioritize and be nimble in the moment to be able to address those needs? And there was a lot of shuffling that was happening, but I think the organizations that had data and had at least information that could help direct them, they were in a better situation than organizations that were kind of turned 180 degrees and didn't know which direction was up or down. And we saw that a lot. We know that a lot of organizations were really reacting day to day and trying to balance day to day priorities with where do we want to go? What was the plan here? And trying to gather that type of information. That's shifting weekly. So just we heard a lot of stress and a lot of just shifting priorities during that time.
Okay, thank you. Thank you. So then moving forward, we'll talk about, continue to talk about impact on project priorities. And here you see on the screen 2021 versus 2021. And what this is Gordian had conducted a survey in 2020. And on the left, you'll see the figures for that 2020 compared to 2021. So what we have there is, let's see, I'm sorry, on the left was 2021, 62% halting, postponing project, 40%, that was 2020 number. So halting, postponing, not surprising, that was 22% higher than the year prior, and then so on. Executing to meet new safety protocols, few percentage differences. Canceling projects obviously was, again, 28 versus 15 this year and last. Planned projects are expedited about the same, and planning new projects due to federal stimulus, again, about the same. So we just wanted to show you kind of what were some of the changes on some of those reasonings and impacts on projects, so we can move forward there. Next slide. Okay, so then the survey we had asked was, when it comes to facilities and capital planning, what are your biggest challenges? So that was asking this spring, the folks, what was going on then at this point, about a year into the pandemic. And as you can see there, 70% had answered balancing the current day-to-day needs and long-term organizational goals. I think Gabby just alluded to that, as did John, with shifting priorities, and nothing new to those of you in the audience, I'm sure, where things are still shifting. And although hopefully stabilizing, 48% receiving budget approval, an ongoing situation for facilities folks, I think. And again, down the line, prioritizing projects, effectively communicating facilities needs, and gathering the right facilities data needed to make these decisions. So let's talk about that a little bit. Gabby, what have you been seeing, and what would some of your thoughts be on those areas?
Yeah, so I think a big driver here is communication and really helping organizations or identify who needs to be in the room or who needs to have a seat at the table, so that there is clarity about what is that shifting priority. As we're coming out of the roller coaster that was 2020, it's really interesting to still see that balancing day-to-day and long-term organizational goals be one of the highest responded answers here. And that to me says, are we really communicating between the finance side and the facility side about what's possible? And about what the shifts are and the changes that we're experiencing. And I think communication is a huge theme for all of these high responded answers, to really help a facilities leader know what direction do I need the ship to face. And at what speed should we be going? Because I think we're coming out of a very reactive year, and now it's time to really take advantage of a newfound understanding of what does it mean to have healthy and safe facilities. What does it mean to be providing a good workplace for folks, or a good living space for folks, or good care facilities for patients? And being able to align that with what the facilities funding is on a day-to-day basis, or maybe what that long-term capital plan is going to be key for really how do we define what the new normal is. John, do you have anything to add to this one?
Yeah, just, when it comes to the facility condition assessment, one thing that I think that's important, and I see this across the state, is don't ignore the results, right? And wait for that next, don't ignore the results and wait for the next assessment. I think it's important to take corrective actions based on those findings. And as Gabby mentioned, is communicating those and developing a good, solid plan in order to get things done. And also, it should be subject to regular iteration and adjustments to reflect changing conditions. And this is what we're going through now, a changing condition, if you will. And so I think it's important to really analyze any of your capital planning and reports, get together as a team, key stakeholders, decision makers, and come up with a good, solid plan to move forward.
Yeah, I think that's really, really clutch, John, that a lot of organizations, they do planning in silos. We have an IT plan, we have a health and safety plan, we have a facilities plan. And what we're learning is there's so much power that organizations can unlock if they bring those plans to the same table and they try to align them. And they're not always going to fit perfectly, but it's creating that awareness, it's creating that transparency within an organization. We work with a lot of organizations to both develop a facility condition assessment, do that work for them, or to analyze and report out on what a facility condition assessment is telling them. And the key here is really, how do we bring this information to life so that it can be useful, but especially flexible as we're riding this roller coaster of exactly what's going on the day-to-day, and cluing the finance side in on what those needs are. I think that really becomes key, is really being able to communicate with the stakeholders, both in finance, but also the tenants within the buildings, and making sure that they know what the priorities are, maybe the organizational priorities or the priorities for delivering service to that specific facility.
So I just have a quick follow-up question. All the stakeholders working together, facilities teams working with finance and maybe human resources, EHS. From my perspective, that's something that of course has been needed before, and many in the audience I'm sure are doing it to a degree. But is that something you saw magnified, or at least throughout this pandemic, you saw the awareness for that magnified? And did you see any move toward that with your clients if they hadn't really had a strong situation in place with that?
We definitely have seen a move towards improved collaboration. Let's call it that. It's almost like for the first 6 months of the pandemic, it became painfully obvious that the right hand was not talking to the left hand at a lot of organizations. That there was duplicated effort, or things were falling through the cracks. And I think what has become more clear is there needs to be better alignment and better communication. So if especially if folks are working from home now, but they're planning to return to work. What sort of leeway are we giving the facilities team or the facility staff to make sure that those buildings are in good shape, especially in the K-12 market. That has been a huge focus for a lot of organizations, is how do we get ready to welcome students back. In higher education, that was a big talking point, primarily because some schools, students stayed. A lot of international students remained on campus. And so it's balancing, how do we provide services? What's the academic plan? What's the residential plan? And how do we make sure that facilities is part of that plan, so it's not as reactive, I think, as it has been over the past few decades, but really saying, how do we get more folks in these conversations so it can be a more coordinated effort?
Thank you. So we can move on to the next slide. Talking about budgets and funding, we were just touched on that a bit. So you can see here, the question was, how have your budget's funding changed in 2021 in the survey we've asked? And 45%, nearly half, had experienced budget cuts. Probably not surprising. We've received more funding, which includes federal funding, was a slice there at 11%. Budget stayed the same for 35% of our respondents, and I'm not sure with 9%. Gabby, would you like to talk about that? And I see we have a kind of a quote here from the American Council on Education as well, I think you wanted to point out.
Yeah, I can certainly talk a little bit about some of the, let's call it an emotional roller coaster, maybe not a physical roller coaster, but the emotional roller coaster of, am I going to get a budget cut? What's that budget cut going to look like? A lot of it's dependent on revenue. And different organizations or different industries have been impacted in various ways. So it's certainly a situation where there is an influx of stimulus money or other federal funding that's coming in now, but it's about figuring out how do we catch up on that revenue shortfall, or organizations looking at creative ways to try to close the gap. If we are making cuts in specific areas, are they systemic or are they sustainable for the long term? Are we changing our business practices? We've seen that with a lot of organizations and trying to balance returning to an office versus remote working, and define exactly how do we adapt our budgets so that we can be more flexible and more nimble. Specifically for the American Council on Education has identified about $180 billion needed to offset the revenue losses and COVID-related expenses to maintain safe operations during the pandemic. That's just operations. That's just day-to-day, making sure that we keep the lights on and that we're keeping those facilities open. The capital budgets have been similarly impacted. Those long-term capital plans have seen a reduction as well. A lot of campuses, a lot of organizations we work with are halting their planning activities, or they're curtailing active construction projects. And so we're really looking at what does that future forecast look like? And I was on a webinar earlier this year where we had a few representatives from higher ed who were talking about, 2021 is not the scary year. The scary year for us is when the dominoes fall and we're looking at 2022 and 2023. Are we going to be able to recover? Are we going to be able to return to what we knew as normal? Or are we trying to work into the new defined normal? So I think when budgets are going through fluctuations, when they're getting cut, or maybe you're being told that they're remaining the same, there's still that sense of urgency of how can I create some flexibility within this model? And a lot of it really comes down to, do you know what your funding is going into? Or do you have a clear understanding of what levers you could pull if needed? And a lot of organizations went through that exercise last year, but I think that's a really important one for groups to keep top of their skills list, because we're not out of the woods yet, and there's going to be a lot more. There are going to be many more obstacles and challenges coming up, and it's the organizations that are viewing it as an opportunity to try something new, something innovative, that are going to probably react the strongest, or have the best outcome at the end of the day. But it's really interesting just thinking about the budgets and the revenue loss, and how organizations are going to try to close that gap.
Thank you. Next slide. So moving on, what events factors are most responsible for changes to your budget from 2020 to 2021? So loss in revenue, reduced staff or occupants in buildings, loss of space due to remote work, air cleaning, quality cleaning expense increases, as we know, supply chain issues and material increases, all playing into this. So let's talk about that a little bit. John, I know you have some insight on this. Can you talk about that? Oh, you're muted, John.
Oh, sorry. So reduced staff or occupants in buildings. We've seen hiring freezes that happened over the year 2020, and still kind of affecting some folks now here in the early part of 2021. One of the other things that I've experienced here recently is supply chain issues and material increases. That has really, delayed projects. Created some challenges for some people that just didn't have the budget to actually move forward with a project that they thought they were going to be able to move forward with. The mindset in 2020 is a lot of folks really start planning, capital planning, as Gabby mentioned earlier, is projects for 2020, 2021, 2022, and so on. And when we come across and experience some of the things that we've experienced this past year, obviously that created a challenge, and so we're having to really change our mindset, really look at our priorities, and reallocate funds to the projects that we consider essential.
Gabby?
So I think a lot of the focus is also on the loss of space, and due to loss of space due to the remote work, and how that also balances with like the reduced staff. A lot of organizations are trying to figure out what's an appropriate staffing level for my maintenance or my custodial teams if we have fewer occupants in the buildings. And so the flip side of that is, do we need to bring back all that space due to remote work? I know that's something that a lot of organizations are talking through right now, as well as potential budget cuts that they're experiencing. For example, in the K-12, in the K-12 public sector, those schools are already facing a $46 billion gap in spending on the minimum investments needed each year to keep those school facilities at a basic level. And so that's something that, again, to reiterate, that people are saying is most responsible for that cut. I do want to dive a little bit more into the supply chain issue that John mentioned, as well as air quality and the cleaning expense increases. So if we could go to the next slide, we have a bit more on those two topics. So when it comes to the supply chain, this is an area where the Gordian data team, we're really focused on understanding the material costs. And what we're seeing in general is aggregated costs are increasing. We're seeing those costs increasing for specific sets of materials, though. And where we're where we're really seeing them increase, they fall into three categories. We're seeing cost inflation due to the COVID-19 pandemic. This is highlighted in lumber-based materials. There's some additional data on the right-hand side of the screen here that gets into some of the line item details here. But we're also seeing costs that were rising pre-pandemic. And continue to rise. Some of those materials are steel, copper, aluminum-based products that have been on the rise and continue to rise. And then finally, the third category here is costs that may not have a sharp increase, but have started to increase. This is something to keep an eye on. So an early indicator that our data team has been kind of blinking at us over the last few months, those interior finishes. Those have become something that we're keeping an eye on, just because it's kind of like a waterfall effect or a cascading effect. If 1 and 2 are becoming an issue, number 3 is going to become an issue down the road. So there's a lot of data analysis that Gordian is working on to try to help our clients, as well as those in the industry, understand what the future costs are going to be, and help predict what those costs are, so that we can help align what budgets should look like, what project selection could be, in order to make sure that you're not signing up for a project that's really 4 times what your budget was, but give you accurate costing and estimating data to be able to work with. The other factor from the previous slide that I want to talk to here a little bit is the air quality and cleaning expense increase. That's highlighted in the blue box on the right-hand side there, with the AC units and the percent increases pre-COVID and during the pandemic. This is likely driven by the need to improve air quality. I know that's been top of mind with a lot of organizations, especially those that deal with students. So the K-12 public sector, the private K-12 boarding school sector, as well as higher education, are really focused on air quality. In healthcare, hopefully this has been a focus, but we've seen a lot of organizations looking at installing or modernizing their equipment, and that's been a huge demand during this time. And many respondents are indicating that they put in new systems, and they're trying to upgrade. So either they've installed new HVAC or they're putting in additional air purifiers. Our research shows that there has been a large shift in the unit costs as well. So we're really trying to help organizations understand what those new costs are. For example, if they've developed a multi-year capital program that they kind of set in stone maybe in 2015 or 16 or 17, and they're using that as a budget model moving forward, those budgets are no longer accurate. And we're working with organizations to help say, how do we help breathe new life into those numbers, so that when you do get to the table to talk about budgets and talk about what's possible, you're working with numbers that are rooted in reality, or are following our pricing predictions for what the cost will be when you are ready to execute. ASHI conducted a survey earlier this year, and one of the facts from that survey, or one of the details from that survey, is in healthcare, this focus was also on infection control. So it's not surprising that healthcare ventilation projects jumped considerably. 46% of the respondents in the ASHI survey said that replacing and upgrading or planning, they're replacing or upgrading or planning to replace or upgrade their air handlers and ventilation systems in the next 2 years. 17% are currently replacing or upgrading their exhaust fans. So there's a lot of focus across industries on air quality, and that's, again, just something that we try to highlight with our clients, and when we're developing those project plans, to make sure that the pricing and the costing is rooted in reality.
Okay, thank you. Thanks for that that dive into those numbers and the topic overall. Thank you. So we'll look moving forward. You know, we've kind of set the stage or talked about what's going on out there. So let's look forward. What types of construction projects are you planning to complete in the next couple of years is in the survey further down. And 65% of our respondents mentioned mostly major renovations, maintenance, and/or repairs. 50% was mostly major renovations. That's the same, most renovations. And then 18% was mostly new construction, 8% mostly additions to existing buildings. So let's talk about that a little bit. Gabby, you were talking about, you know, changing numbers and kind of fitting the reality now, and I'm sure you both have been talking with clients over the past year, you know, to kind of reset and set a new plan for these folks. So what have you been seeing as it aligns here with the new plan, I guess, is the question.
Yeah, the new normal, right? And I think everybody's trying to figure out what that is at the same time. But the general theme from the conversations I've been having in the K-12 market, in state and local government, healthcare, and higher education is everyone's really looking at space as a different a type of asset. And really trying to get a sense of, do they really need to build new? Do we really need to execute the plans that we had put in place before, or can we reconfigure what we currently have? What does return to the workplace look like? Do we need to add more space for social distancing? We saw that from the initial question that was one of the ways that organizations responded initially. And that's a conversation that a lot of organizations are having, is to determine what's an appropriate amount of space. I mentioned before the ASHE healthcare survey, but that indicated that hospitals are focusing primarily on renovations versus new construction. And more importantly, outpatient versus inpatient projects. The funding that organizations said they're going to be spending over the next 2 years is building or planning acute care and specialty facilities, medical office buildings, physical plants, and ambulatory facilities. And it's our data is really highlighting that, especially with the rising costs that we just went over and the supply chain issues, that there's added value right now in doing renovations. And in trying to breathe new life into your existing facilities versus building new. Building new may have been on the plan before 2020. It was probably on the roadmap. But a lot of industries such as residential or new commercial are looking at what the cost is today to build new versus the cost of renovation. Gordian, we're seeing the rise in total construction costs for residential construction due to the lumber-based products, and lumber being part of those supply chain issues, as well as one of the quicker growing costs for individual materials. So residential costs have increased about 11.5%. Primarily driven by those lumber-based products. When we're seeing new commercial construction costs, those are increasing by about 4%. So it's less than residential, but it's still a key driver. And it's requiring a lot of organizations to reevaluate budgets and reevaluate their priorities. In general, you know, we're big fans of doing renovations just because you already invested in that facility. You spent the time and the energy to construct that facility. Let's adapt that facility to better meet your needs today versus building new. Because I think what a lot of organizations see is when we build new, we don't necessarily grow the operating budget appropriately or in proportion as the space grows. So when we talk about the capital projects, I think it's really important to keep in mind that if we add new space, that's also going to have an effect on the day-to-day operating costs as well. John, anything to add on this one?
I think you I'm going to figure out this audio here pretty soon. No, I think you covered it all. I think, obviously the major renovations, maintenance and the repairs, it's up there as far as percentage goes. I think a lot of folks are still seeing that those renovations need to happen for several reasons. One could be reallocating the scope just because of the impact of COVID-19, and then growth. We can't ignore the fact that there's a lot of growth out there. And so that always leads to renovations and, adding additions to existing buildings and whatnot. But I really like the idea that Gabby had mentioned earlier, and we see that quite a bit now, is really repurposing existing facilities and creating space for the future for those existing facilities that otherwise didn't have a priority on the list, but other than to demo. And we've seen that here in K through 12. We've had a couple of portable buildings for schools that were initially scoped to actually get demoed. And since now that we're in post-COVID, well, now they're being transferred over to a different site to create more space. So see a lot of that coming on now.
Okay. All part of that adapting, right? Yeah, okay. Okay, thank you. So we'll move forward and so we can hopefully get some Q&A in, and please do continue to send your questions in. Let's see. So what hinders you from completing more work, or what slows your team down? So moving forward, assuming that you are doing some projects, I'll just quickly go through the top two here and then let you two jump in. 41% of our respondents said the construction procurement process, putting projects out to bid. 31% mentioned access to responses from local quality contractors. And then so on, scheduling, detailed project scopes of work, project pricing negotiations, and change orders. So let's see, I'll pass that over to John. Can you talk about what you're seeing there, what you've been seeing with your clients as it relates to some of these challenges?
Sure, thank you, Ann. Even before COVID, we saw a lot of folks going through that procurement process and delaying projects or extending that time frame. And so we had to learn how to schedule those appropriately to where they're not affecting what needs to be done at a certain time. And what I mean by that is, for instance, if we have an addition to a school, for instance, coming up in the year 2022, well, we start talking about that now. We start developing a plan now. We put that plan into place and we start moving forward with that. So it's no surprise that we see that as still one of the top responses as far as challenges go. Scheduling is something that I've been seeing a lot more of here lately, especially because of the inflation of material costs. And it's becoming a challenge to really put schedules together when we don't know when those materials are coming in or how long those materials are going to take to actually come in. And so getting that's been a challenge that we've seen here lately. And then developing detailed projects, scopes of work. That's another thing that's kind of up there with scheduling. And, again, it just comes down to communication. It comes down to a good plan in place. It comes down to really having the key stakeholders in place and ready to make decisions and all on the same page.
Can we move to the next slide? So John, I know if you want to continue talking about some of these challenges to project scheduling, can you talk a little bit about this one?
Yeah, absolutely. And again, we're talking about, when it comes to actually scheduling projects, we look at financial budget constraints. So we've had a lot of things to change. We've had to really change our mindset and how we're applying our time and efforts into the next job. Labor shortages and quality. We've experienced that quite a bit. Material and supply chain, which we've already talked about as far as the inflation of some of the construction projects that are happening now. Timing issues, COVID, access to facilities and buildings. Gabby kind of touched on this a little bit earlier, where we're talking about healthy buildings and we're talking about how are we going to access these facilities post-COVID. What's going to make it safe, not only for our staff coming into and for some of you, for some of the public as well. So there's been a lot of challenges that have occurred in the past couple of years, as we all know, and we've all experienced. And I think that, one of the terms that has become really popular, especially to veterans like myself that are out there, we've had to learn to adapt and overcome. And I think that's where we're at now. is we've been through the battle per se, and now we're at the tail end of it, and we're now planning to recover and really overcome some of those challenges by making some better decisions.
Okay, thank you. So next slide. So what project delivery methods do you plan to use for your upcoming construction projects is another question we asked. And 52% was the leader there with design bid build, followed equally with design build and job order contracting, IDIQ, and construction manager at risk. So let's talk about that a little bit. John, can you comment on what you see here in your experience?
So really quick, because I really want to get to the Q&A part and make sure that we can answer some of those questions. But at 52% design, bid, and build, we're still having to go through that process. Obviously, you know, when we start looking at projects, we have to look at not only what's the cost of these projects, but we're also looking at the scope, the complexity of the project, and then obviously following the guidelines, right, internally and externally. So design, bid, and build is one. Obviously, design, build, job order contracting. If we're looking at things which we have in the past, is we're looking at projects that got to get going. We got to get started as quickly as possible. And so then we look at job order contracting through IDIQ. And so that really speeds up that process, the procurement process, and really helps folks kind of get things started rather quickly.
Thank you. And I think we can move along then. Okay, so let's, next slide. Can you tell us what we're looking at here, John? Some of the construction services available through co-op contracts and interlocal agreements?
Yeah, and so going back to the job order contracting is, you know, we have several cooperative contracts throughout the state and country for that matter. As you can see, PACE, Byboard is really a popular one out there, Sourcewell, CES in the New Mexico area as well. But so as you can tell, we have several different cooperatives to work through and interlocal agreements. And again, cooperative purchasing, cooperative services, we're talking about job order contracts. We're talking about scopes that fit within the criteria to actually perform a job order contract, speeding things up and getting things going as quickly as possible. And that's what we're seeing a lot of.
Thank you. Next slide. Okay, so let's talk about technology. I know we mentioned data, and data is very important to all of this, really, to make the great decisions and effective decisions. So we did want to ask in the survey, of course, about technology and any changes or increase in use out there as far as our respondents. And the question was, has your organization increased its use of technology in your project planning, schedule, and execution, you know, since the pandemic had hit? And as you can see, it was pretty much of a split. Some of the ways folks had been using is walkthrough surveying tools, virtual meetings, building construction software, and adopting project management tools. So let's just take a quick look at this, Gabby. What have you seen or interest from perhaps clients, you know, through these changes of the past year?
Yeah, so what we're hearing a lot is that for the folks who are on the no side of this, some of the reaction that we get is now's not the time to invest. When we're going through budget constraints, that's not a time to try out new technology. But we have a whole lot of clients who are saying we just haven't gotten there yet. We're trying to work towards that. We need to put more structure in place before we can add new technology, such as maybe a building information modeling software system or BIM. It could be additional project management tools, such as that's mentioned here, in trying to coordinate virtually or coordinate without being, you know, around one conference room table, and figure out how do we do this with modern technology. A lot of the organizations we're working with, it's been really great to see the evolution of, you know, not being used to working with GoToMeeting or Zoom or anything like that. We're all pros. Or at least we fake it. But we're all adapting to that new technology. I think something that we hear a lot is that it is something that organizations want to do. It's just finding the right time and then the right solution for their organization. And so that's why at Gordian, we constantly work at trying to figure out how do we create technology or information that isn't a hurdle for organizations to adopt. And that's a big focus for us, is making sure that we're creating something that the user can actually pick up and use, as opposed to like a robust system that may be more cumbersome or more intimidating from the get-go. So it's certainly something on a lot of organizations' mind. To try to get us through to the Q&A, I'm just going to quickly go over the key takeaways. That's on the next slide. So what we've talked through today over the last 45 minutes or so is just really a focus for organizations to think strategically about their capital planning, and for them to also think strategically about their project and construction implementation. A lot of this is communication and evaluating old plans, trying to make sense of the space changes, and having those conversations. I think that's a major hurdle that organizations kind of keep going and they don't know the answer to some of their questions. And we really try to create bridges within organizations to say, let's get more people to the table so that we can talk about what some of those long-term goals are. As well as trying to find delivery methods for those construction projects that make sense, that work within the time constraints or within the budget constraints that the client has. And finally, looking at the resources available that organization might have access to. Are they part of a cooperative purchasing network already, so that they can take advantage of doing work through that network with different delivery tools? So just some of the key takeaways from today, but certainly want to turn it over to you, Anne, for the Q&A.
Sure, thank you. Thanks to both of you, and thank you to your audience for the questions you've sent in. So I just want to point out we have here Gabby and John's contact information if you would like to follow up with them, and you will be receiving the slide deck from Gordian within a week or so if you're interested in seeing these slides and reviewing what we've been talking about here. So yeah, we do have time for a few questions, and I will just kind of put this out to both of you. And I guess one of the questions was, and nimble was talked about, flexibility, adapting, and I actually just took a few notes here where I see that as applying to budgets, maybe space use, type of use, and scheduling. You mentioned scheduling, John. So how quickly they change these days, data seems to be a central part of this. And how would you create a plan to be able to adapt and kind of start a new path with construction projects and renovation projects? How does data play into this, or any other kind of advice you have for being nimble and adapting? Whoever wants to jump in first.
Yeah, I can jump in. So what we recommend for folks who are kind of starting from square one is to get a sense of what your needs are within your facilities. What are those priority projects? And by doing a holistic evaluation or establishing a baseline for your facilities to understand what those needs are, that's going to help everyone in the organization understand what the risks are for doing the work, for deferring the work, for prioritizing one project over another. And then you're able to start laying out what that program is going to look like, and can start talking about estimating out those costs, and really lining up those projects with contractors, and ensuring that service delivery is happening on time and on budget. But I think it starts a lot with really understanding where your facilities are at today, as well as what your programmatic needs are within the organization. John?
Yeah, I think you said it all. Again, it's just understanding your state and where you're at today, really understanding what that is, the impact of what we've experienced, and then getting together and planning for the future. We've kind of reiterated this throughout, and I do it again, is it's just communication. is very critical at this point. And facilities planning is a very critical component when it comes to really looking at what we're looking for towards the future. Obviously, there's a lot of changes, but then there's some that are minor changes or things that really didn't change at all. But those things really need to be communicated, put a plan in place, get some scopes down on a piece of paper. Let's get the data in front of you, and let's put something in place and get that planned out for the future.
And John, you had mentioned facilities assessments. I mean, obviously, those are before the pandemic as well. But is that something that you would recommend as you're starting to shift your new plan? Is a facility assessment a starting point, or is it something less than that, or do you go to a full facility assessment for this type of COVID adjustment?
Oh, absolutely. I think going through a facilities assessment, I think it's very fluid, right? I think it was happening before the pandemic. I think it happened during, but I really think that it's more important now, more so than ever, that not only are we doing a facilities assessment, but we're doing something about it. We're creating plans based on that information. And I've seen somewhat in the past where we've seen a lot of folks get those facilities assessments and let them just kind of just sit there until, you know, something happens, something changes within their organization that allows them to actually put something in place according to that analysis. And so I just think it's important is a facility assessment really needs to be followed up, really needs to have a plan. You got to have a plan put in place for that, for the results.
Okay, thank you. So time for last question, then we'll wrap up. Looking ahead, talking about workforce, because that's part of obviously being nimble, and I'm sure many facilities have seen some adjustments there. So what other ways will the workforce need to change to adapt to new facilities needs? What are you seeing as how people themselves can adjust and plan, leaders and teams?
I mean, you're looking at a lot of changes actually, and it all starts from how you're entering a building. It goes on from there. It goes on to the space that's being created within the buildings. And so there's a lot of things that have changed over the past year. And I think as far as the workforce goes, we really have to think about safety. We have to think about space. We have to think about how to be effective. We've seen a lot of remote employees. Some folks aren't coming back to the office. Some are essential that need to be really back in the office. And so there's plans in place for that. I've seen quite a bit of change in some of my own clients that I've walked into, and there's hand sanitizer bars as soon as you walk in. Some are still doing temperature checks. Some are still requiring face masks. And so there's a lot of things that are still in place now that I don't think will go away in the future. I think it's just a matter of, maybe becoming a little more innovative as we move along, but at some point we're going to get to be able to walk into a building and still talk to folks, visit with folks, but through all the safety measures that we've experienced in the past.
I think my quick answer to this would just be technology and lean into it. That we've seen a lot of, I don't want to say pushback, but a lot of hesitancy about technology. And I think that very similar to what John was saying of getting used to some of these elements that we're dealing with today. I think technology is going to be something that once an organization adopts it, it's the workforce working to better learn and be innovative with that technology. And I think that's probably one of the bigger growth areas for each organization, is having people on your team who can take that technology and run with it, and providing training to those who maybe aren't as quick to adopt new technology. But I think that's going to be one of the big factors moving forward.
Okay. All right. Well, thank you very much, Gabby, and thank you, John. Appreciate your time today and your sharing your experiences. Thanks a lot.
Thank you, everyone.
Thank you so much.
And thank you to Gordian for sponsoring this webinar. Of course, to our attendees for listening in and for sending in some of your comments and questions. Again, contact information is on the screen, and you can also visit Gordian.com to learn more about what Gordian offers around what we've been talking about today. You will receive a the slide deck from Gordian in the next week. And also a recording of this webinar will be available on our website. That's facilityexecutive.com and also gordian.com. Thank you very much. Have a great afternoon. Bye-bye.
Okay.